The Backyard Initiative is a partnership between people residing in South Minneapolis and Allina Health to improve the health of people living in this community. As we went out and started talking to people and understanding what health even meant and get an understanding of sort of what the problems were, I think one of the key things that was a real switch early on was the realization that this was not about the people living in Allina's backyard. This was all about supporting people who have Allina Health in their backyard to improve their own health and well-being.
What the Backyard Initiative became is kind of a strategy for residents who live in this area to step up and take their health, their sickness and disease, take it seriously, take it in their own hands, and work with the existing resources to be successful at that. That's what it became.
We had 4 health priorities that were defined for the Backyard Initiative: social support, social cohesion, health education, and health empowerment. And our evaluation results showed significant improvement on each of these factors.
I think the other thing in the achievement had to be, how do we study what we're doing? How do we document the story? So our evaluation design included one of the very strong principles of this partnership, which is that residents, community members have the knowledge and the leadership and will define and redefine what gets studied, what gets documented, how things are interpreted and translated from those experiences that they're having.
I got involved with the Backyard at 19, and I came in and it really gave me an opportunity to develop my leadership skills. Working with people over at Allina Health and having them kind of sit down and take time to even talk and listen to me, value what I'm saying, it makes me feel like I can do this type of work. It makes me feel like me bringing my friends into this community was a good call for me.
We worked with members of the community, and community members came up with their own definition of what it meant to be healthy and what would make a difference to improve health.
To have people take the lead on what are the ways that particular diseases and conditions are really addressed, and what is the upstream approach to that. So an upstream approach to diabetes is not just how do you do your A1C, but more, who do you eat with? Are you alone? Are you a part of a group that grows vegetables? And the other part of the infrastructure were the chats, which is how the residents of the area were organized. And in those chats, the activities were designed by the residents who were leaders in those chats. And so our role, Cultural Wellness Center's role as lead agency, was the kind of keeper of the partnership and the developer of the infrastructure that kept the partnership going. So the Backyard Initiative brought resources to the table. They were able to really take the cash that Allina brought to the table and multiply that cash many times by their own involvement and by the way they valued their involvement, their leadership, their thinking, and their activism. So yes, we were successful.